We do a wide range of health services, and we take a broad definition of health. So that means I get to do a little bit of everything. I get to do some strategic planning, and we get to make sure that we are keeping our citizens healthy and safe in our community. So I get to do a little bit of across the board.
Jack of all trades. We love it. So today we are going to, first give you some preliminary information, just a few housekeeping things. Everyone's mics are muted, except for us as the speakers. So if you have any questions that you'd like to ask, we ask that you put those into the question box. And if you have any comments, you can put those into the chat box. All of the links and resources that we share for this meeting are going to be posted to our website, cumberlandcountync.gov. After the meeting, you can click on departments and find public health. And then we'll also be replaying this show. So it is being recorded, and we'll provide it on North Carolina TV, CCNCTV, which is our 24-hour channel that focuses on Cumberland County government. And that airs 7 days a week on Spectrum Cable, Channel 5. And then you can also stream the show following the recording on YouTube, Apple TV, Fire TV for free on the CCNCTV, and then also see them on our social media pages.
And Tamara, I put that link in the chat box for those that are watching it live, so you can see the link to where our website is for this particular Hello Health series.
So again, thank you all for joining us today. Today, we are going to share a little bit of information about health literacy and what it is and how this is relevant to our goals for this series. Kind of lunch and learn style. So hopefully you've got your snack off to the side as you learn a little bit more about it. So starting off with our first question, what exactly is the Hello Health Literacy Series?
So we are launching this series. One of the goals of our strategic plan at the health department is to improve health literacy in our community. So we want people to not just know how to read or write, but we want them to be able to process and understand health information, which is different than just being able to read and write. So we are launching this series to help improve health literacy. So we're going to take a deep dive into array of different topics. And I know we're going to talk about what topics we're going to cover in a little bit, but an array of different topics every month, and take a deep dive and help our community members think about how do we navigate the healthcare system? How do we navigate the public health system? How do we get access to health services? How do we understand the information that is being given to me? And where do I find it? How do I get it? How do I make that meaningful to my family and to myself?
Yeah, so I think really that distinction there is different than just knowing how to read or write, but do you understand the information? Do you have access? Is it palatable for your life? Can you apply it? So we know what it is and a little bit about why it's important, but kind of tell us a little bit about the health department's efforts and how we're trying to be equitable with our health literacy efforts.
So we want to center health equity at everything that we do. And what is health equity? Health equity is not just we're treating everybody equal, but we want to make sure that the services that we provide meet the needs of the people that we're serving, right? So we are the services that we provide for one citizen may look different or appear different for another citizen, so that we meet the needs of all 300,000 plus of us that live in Cumberland County. And so one way that we do that is this series around health literacy and improving the knowledge of our community members so that they can make informed decisions for themselves. But we also do that every day at the health department. So we provide immunizations here in our building for those that want to see immunizations in a very traditional setting, or STD testing in a very traditional based office setting. We also do outreach clinics, and we provide immunizations in churches and STD testing in community centers. And so our services look a little bit different. That doesn't mean you're getting a different quality of service. That just means you're getting it in a way that meets the needs of yourself and your family.
Love it. So we are definitely trying to make sure that your needs are met. And this includes being equitable, having a strong health literacy capability. And so if there's any additional support that you need, be sure to reach out to us here at the health department. We'd be happy to provide that support. So as we're going forward with the series, we want to let you know a little bit more about what we'll be doing with these conversations. So today, Dr. Green and I are here to share information about the series. We'll start off with one of our topics, which is kind of like our introduction to respiratory virus season, talk a little bit about COVID, flu, RSV. But in some of our future episodes, we'll be talking about sexually transmitted diseases. We'll highlight some of our campaigns or awareness months. There's an awareness date for everything. So we'll highlight some of our awareness dates that we're honoring here at the health department. We'll highlight some of our programs, like our Positive Parenting Program, or Triple P as it's known. We'll talk through Substance Use and Recovery Month with our Cumberland Fayetteville Opioid Response Team, or our CFORT, Prematurity Awareness Month, Breast Cancer Awareness. So thinking of health topics that people in our community may be experiencing, and bringing them some information from subject matter experts, which could be panel style version, or also could just be a presentation from someone in those fields. Anything to add there, Dr. Green?
We want it to be interactive. So we're on a webinar style right now, but if you're re-watching it or you're watching it in the future and you're hearing us talk about topics that we're going to cover, we want you to ask us questions. So if you're live on with us today, you can put like Tamara said at the beginning, you can put your questions in the chat box and we'll get to those. If you are re-watching it later, or you hear about a topic, or you go to the website, and you see in February, they're going to be talking about syphilis and other sexually transmitted diseases. You can email us your questions in advance at hellohealth@cumberlandcountync.gov, and we'll put that in the chat box for you. That's hellohealth@cumberlandcountync.gov, and we'll try to answer as many questions as we can for you in the topics, and we'll use that to kind of inform this. This is, we're not going to do death by PowerPoint here. So today we don't have any slides for you. We want it to be fun and light, and we want it to, meet the needs of what our community members are telling us. We really want to know more information about this.
Yeah, so if you're looking for more information, you can find that again on our website, cumberlandcountync.gov. Click on that Public Health Department tab and go under videos, and you'll find the information for this series, including any of the resources that we share. And I just put into the chat that email address. So if you have questions or want to ask us about a particular topic, you can email us there.
And then Tamara, one of the things, we're going to be giving a lot of resources throughout the year on each of the topics that we mentioned. And I know for folks that are listening, you go, okay, well, I can't write it down fast enough. So we're going to put those on the website. So after every session, we will have a box on our website that has the links for this session. So if you say, oh, I remember sometime 6 months ago, they talked about syphilis, and I can't remember what they said, but now it's meaningful to me. You'll be able to go back and get all the links and all the stuff that we put in the chat box, and then some answers to some frequently asked questions that might come up.
Yes. All right. So we have hit the point for our topic for today. I mentioned the C word. We try not to say it, but we know it's still real, COVID. So our introductions into our 3 respiratory viruses that you're possibly concerned with this season, may have already experienced RSV, COVID, and flu. We'll share a little bit of information about that. And again, if you have questions, go ahead and pop those into the chat. And at the end, we'll go ahead and make sure that we've answered those. So Dr. Green, tell us a little bit about the key metrics for these particular respiratory infections.
So there's a lot of respiratory viruses out there that we care about just during this season. But the ones you're going to hear from us most talk about are COVID, RSV, and flu. And we kind of hit those big 3 because those are the ones that are circulating now. And so for all of those, we look at 3 big community metrics. So people might remember back in the early days of COVID when we were on a weekly, sometimes daily basis, telling you how many cases that we have. We are counting individual cases of COVID. We are counting individual numbers of positives and negatives, and people will remember the case positivity rates, and we had the green and the red and all the colors of the rainbow, right? Of like, what color were we in this week? We have shifted away from that. That's less important to us to count those individual cases. And we're going to talk about why in a minute, why we don't count individual cases anymore. But we look at other key metrics to help inform it. So it's not inform us. It's not that we don't care about those data points anymore. They're just less meaningful. So we look at other data points. So we look at 3 big ones: our hospitalization. So how many people are showing up to the hospital? We look at the number of people that are showing up to their emergency department. And then the number of people that are our wastewater data. And the wastewater might be a little bit new for people. And I'm going to pop a link in the chat box. And this will go on our website later, to our state health department's dashboard. They have, and I'm going to see, actually, I can see if I can share my screen with you all. Our state health department has a really good respiratory virus dashboard. So bear with me if data is not your jam just for a second. But they have a great dashboard that we can look to see what's going on with COVID in our community and across our state. So the first one that we talked about was emergency department visits. So if you look on the chart on your screen, you can see for COVID is in blue. In flu or influenza like is in green, and then the goldish yellow color is in yellow. And that will tell you over time, starting back from last year, this time last January on the left side, what COVID looks like and how many people that show up to the emergency room, what percentage of those visits are due to COVID, flu, and RSV. So the little bit of good news, I think, if you look at the very end, those numbers are getting better, right? We're seeing a little bit of a decrease of COVID, flu, and RSV, the people that are showing up to the emergency room for those respiratory viruses. And that number is important because that tells us what infections are going on in the community and how severe our infections might be. The other one we look at is hospital admissions. So how many people are not just showing up to the emergency department, but are actually going to getting admitted to the hospital. And so we do that for flu and we do that for COVID. COVID's in the blue on your screen. Influenza or flu is in the green. We've seen just a little bit of a decrease of admissions to the hospital for influenza, maybe just a little bit of an increase for COVID, not much. But that number is important because it tells us our hospitals being overwhelmed. So we remember in COVID, you saw all the stories about people setting up tents outside of the hospital. We don't have enough beds. We don't have enough space for everybody. And that's important because if you get in a car accident and it's full of folks that have COVID or flu,
strained to respond.
Right. We won't be able to respond. So we want to track those numbers really carefully. So that's why that number is important. And then the last one is what might be new for folks is our wastewater data. So somebody, not me, goes out into the community and they literally take a sample of our wastewater and see how many COVID-19 particles are in our wastewater. And that number is a number that's important because we call it our early warning indicator. Right. So if those numbers are high, typically if our wastewater is high, we see later on in a couple of weeks, hospitalizations are going to go up. So. Gotcha. So that number is important to look at because it kind of gives you a forewarning of, that wastewater number is going up. We're going to see more people in our hospital, and then we can better plan and prepare for that.
There you go. So if there are some really, really smart people out here analyzing all the facts and counting up all the numbers for me, how do I know what to do next? Like, it hasn't gone away. How do I know that I need to wear a mask? Or do I go to the ER? Do I go to urgent care? What do I need to do? What type of tips do you have there?
Yeah, so these numbers are important and because they tell us what to do next, right? So we recently, and kind of the December, January timeframe, we've seen people, hospitals across the state say, we're going to go back to visitor restrictions or we're going to have you wear a mask in our office. These numbers are what inform that. So if you see these numbers go up, don't be surprised if your local hospital says it's time to put visitor restrictions back up in place because that means we need to protect the patients. These numbers might also inform if you want to put a mask back on when those numbers start to tick up and are getting really high. If you are an older adult or you're immune compromised or you have an underlying health condition that might put you at risk, that might be the time to say, I really want to think about putting a mask back on for me and for the protection of my family. That number, those numbers give us a good indicator to remind us it's time to get a vaccine, right? So, but I'll give this caveat. We don't want people to go, oh, those numbers are low. I don't have to get vaccinated. That's not what we want you to do, right? We always need to get vaccinated. That's our best line of defense. But these numbers really help to inform what other actions we might need to take. We should always be washing your hands, right? So you don't have to look at the number and go, do I need to wash my hands?
20 seconds front and back.
sing a little happy birthday twice. Always, you should always be washing your hands. But those numbers really give us an indication of other things we might need to be doing in our community to help protect ourselves.
Okay, so I need to get my vaccine or a follow-up vaccine. They've got some updated versions for COVID. Flu vaccines are available now. Certain groups are available to get RSV. Where do I need to go? What do I need to have? How much does it cost? What does that look like?
Okay, so let's run it down from the top. So that's a lot. So let's start with COVID. So everybody needs to get a COVID vaccine. Okay. Everybody 6 months and older needs to be getting a COVID vaccine every COVID season. So if you got your COVID vaccine with us at the Crown 2 years ago, you were out of date. You need to, if you have not had your COVID vaccine since September 2023, it is time to get a new and updated COVID vaccine. Okay. So everybody, COVID vaccine 6 months and older, you are eligible to get a COVID vaccine. Your COVID vaccine from last year or last fall or last in 2022 is not good anymore. New COVID vaccine. Those vaccines are free.
$3.99.
Free 99, right? So people remember that the public health emergency ended in May. So that changed the whole vibe for how we pay for vaccines. So that for a lot of people, that date just like passed us and we're like, oh, yay, no more COVID. But for us in public health and in healthcare, that meant a lot because that changes how we pay for vaccines. But I want to take the opportunity to shout out our county commissioners and our Board of Health because they advocated and those vaccines are free. So if you, regardless of your insurance status, your COVID vaccine is free. If you are a child, it's free through a federal program that we call the Vaccines for Children program. If you are an adult, thanks to our county commissioners, those vaccines for our adults for COVID are also free.
Awesome. That's really great to hear. So for maybe adults that have those free vaccines and children that are covered, which groups are maybe going to have a little bit of a barrier, and what should they do to try and get those vaccines?
Yeah, so we have a lot of resources. So one we do for all of our vaccines, we'll talk about RSV and flu in just a minute, but for all of our vaccines, we have a walk-in immunization clinic. So you do not need an appointment for us. You can just walk in and Monday through Friday, beginning at 8 a.m. And you do not need your health insurance. You don't need health insurance. So if you have health insurance, bring it. We'll bill it, but you will not get a charge if you are uninsured. If you are uninsured, we will take the cost and we will cover the cost for those if you are uninsured. If you need transportation, I'll take a point of privilege and tell people about our Uber Health program. So at the health department, we have Uber Health. So if you need a ride, just call us at 910-433-3600 and we'll help you get coordinated with a ride for Uber. If you go to your primary care provider or you go to like a pharmacy and you do not have health insurance, that may be where you are going to get charged. So if you do not have health insurance or you're underinsured, your best bet, your easy bet is to come see us at the health department. Because if you go to a pharmacy, depending on how that pharmacy gets their money, they may charge you if you do not have health insurance.
Gotcha.
Yeah.
So for all of our viewers, I know some of you may identify also with this. I feel like I'm allergic to the outdoors.
Yeah.
I am an allergy and asthma sufferer. What should I know about the flu?
Yeah, so it is flu season. And the question that we get all the time for people that have allergies are, how do I know if it's the flu, right, COVID, or allergies? And and we're going to get to testing in a minute, but you just don't know unless you take a test. Right. So it could be flu, it could be COVID, it could be COVID, it could be RSV. We don't know until you take a test. And I'm so sorry for all my allergy sufferers. But
it's bad.
I'm so sorry. But that is the only way to know for sure. There are some differences, but the only way that we can really know for sure is if you take a test. So for flu, similar to COVID, it's a different vaccine. It is 2 shots, 2 separate shots, I should say. But you have to get everybody 6 months and older, same population, everybody 6 months and older, flu shot every flu season. So if you got it in January 2023, it is now 2024. You need a new flu shot this year as well, or this flu season as well. So everybody 6 months and older, with very rare exception. Same thing as COVID. It's also free. Thank you, county commissioners, for that. Regardless of your insurance status, you can come get your flu vaccine for us.
That's great to hear. So as we're learning more about health literacy and our understanding of our options and health choices and things that we have access to, making sure that you know that you can come over to the immunizations clinic here at the health department, 1235 Ramsey Street, and you can get your vaccination for free, FREE, and get that for flu or COVID as well. And so you said we don't know unless we know. We don't know unless we get tested. So how do we test, or where can we get tested at? I know we had at-home test kits at one point. What is that looking like?
Yes. Okay. Can we do RSV first? And
sure.
Then let's do RSV.
I missed the trifecta.
You got, yeah. So let's do RSV first, and then we'll go back to our COVID test, which we have here. So for RSV, that one's a little bit different. This is the first time we've had an RSV vaccine. So we have our babies, our pregnant women, and our older adults. So if you are 16 or older, we want you to be talking with your healthcare provider about getting an RSV vaccine. You want to have a conversation, ask some questions, and then your healthcare provider will help make a recommendation. If you don't have a healthcare provider, come see us. We'll help you. We'll help you. If you are a pregnant woman, you have until the end of January, which is 6 more days, right? And in the months to get your RSV vaccine. So pregnant women are also eligible for RSV. That one is really important because we have a shortage of vaccines of RSV vaccines for our babies. So our youngest babies are also eligible to get an RSV vaccine, but that's not a Cumberland problem. It is a nationwide shortage because of demand for our RSV vaccine. So if mom gets her RSV vaccine, then baby will have some level of protection once the baby is born for RSV too. So it's important that mom gets it, and typically you're going to get that during the last part of your trimester for mom. So talk to your healthcare provider about that. For pregnant women, if you are our patient at the health department, we have those available. If you are not our patient for a pregnant woman, we want you to go see your pregnant woman, which is a reminder, we need all of our pregnant mamas to be in prenatal care. And we're going to shout out our childbirth education class at the end, but we need all pregnant mamas to get into prenatal care. And then the third group that's eligible for an RSV vaccine is our babies that are firstborn. We want them to be getting a vaccine, and we do have that available at the health department.
It's definitely equitable, making sure we're getting people what they need, where they are. So new babies definitely need it. Yes. Okay, so we got our trifecta, yes, and we want to get tested. Where are we getting tested? What does that look like? Yes,
so people will remember that we had lots of drive-through testing. If you rejoin us in 2024, we no longer have drive-through test sites. What you will most often see now are at-home test kits, and I have one. So they look like this. They come in a box. We want people to get tested. Typically, they come in like 1 or 2 in a kit. We mentioned that the public health emergency ended in May. So the payment for all of these looks a little bit different. If you have health insurance, your insurance most often is going to cover the cost of these. If you are uninsured, come see us at the health department. We have at-home test kits for free. So if you are uninsured or you don't know your insurance status, your best bet is always to come to us, because we will help figure out where to put, how to get you services that you need. But, and then the other option for at-home test kits is to order them from the federal government. People remember from a year ago, you could order your free at-home test kits from the feds. You can do that again now. And actually you can get 8 total for your household. So you can order 4 of them twice, if that makes sense. So you can order 4 and then you can order 4 more. And they type in your address and they're shipped to you. This is my one that I got from the federal government. I sat down at my computer one day and then typed in all my family members' addresses. And in about 10 minutes, I ordered them for like my grandma, my aunt, my mom, my sisters, everybody who I knew was not going to sit down and do it. And so now I have my nice little supply. They came in the mail like a week or so later, and then everybody else got a little Christmas gift for theirs. So learning something new here today, that you can order them online through the federal government, and you can take on that new health literacy skill and teach someone else how to do that as well. And we're going to put it in the chat box for you all.
So you'll have the link there in the chat.
Yeah.
And you mentioned getting them here from the health department. So if we can get 8 from the government, how many can we get?
Oh, that's a great question. So no limit on the ones that you can get from the health department. Just come in down at the desk. You'll go say hello to Miss Wanda down at our information desk, and she will give you some free at-home test kits. We want people to be reasonable, right? We want people to be respectful of all of our community members that might need test kits, but you can come pick up some from your household. If you are a community agency and you need test kits for your community organization, you can also reach out to us, and we will, let's say you're having an event and you want to come give some out, reach out to us and we'll also help you get some. If you need a bigger supply of those for your church or your community organization, our friends at WIDU hand them out. And so we'll make sure you get what you need.
Awesome. All right. So if I've gotten my test kit and I've had it for a while, haven't had any symptoms, haven't been exposed to anyone, don't think I've got COVID, how long is this going to last? Can I keep it forever and it'll be useful down the line?
Yeah, you cannot keep it forever. So if you have like a 2020, late 2020, and I can't remember when we first had test kits now, you might want to check the expiration date. And so you can look on your box. Mine is on the back of the box, and you'll have a number that says, it'll say lot number, and then it'll have a use by date. So this one says 7/17/2024. But before you throw all of them away, you can please check the website. And the website's on your screen, at the top of the website, the FDA website that we put in the chat box, you can click on this link right here, and it will tell you to check your expiration date before you throw them away. So the FDA has extended the expiration date for a lot of COVID-19 tests. And so you want to click on that link and then check it'll ask you to type in the number that's on the back of the box. That's called the lot number. You'll type that number in, and then you will check to see the new expiration date. So don't throw them away. If you got them last year, if you got them in 2020, probably not. Probably not. But if you got them last year, these will likely be extended, the expiration date. So check them before you throw them away.
Gotcha.
And there's a state, our state health department also has a website, if I could find it. And you can also check your expiration date there. So you can kind of see on the screen, you've got a lot number, and then you want to check that expiration date to see what the new date is. And I'll put that link in the chat box. So 2 places where you can go and check that out.
All right. So learned a lot here about the availability of vaccines and how we can test ourselves and make sure that we've got resources on hand and available for ourselves and our family members. Let's shift the conversation a little bit over to treatment. So if I got a runny nose or I catch a little rash from my outdoor allergies, fine, and I can identify that and it goes away quickly. May not be a sign or a symptom of flu or COVID, but if I'm actually feeling symptoms that are identifiable and associated with COVID or the flu, how do I treat, or where do I go to get treatment? Yeah, so this is one service that we don't do at the health department. We are not a test to treat location here at our health department, but there are many, many test to treat locations in North Carolina. So test to treat is I'm going to get tested in the same place that I'm going to get treated. So I'm going to get tested, and then my doctor will help me, if I test positive, will help me get a treatment option that's going to be free. And those test to treat locations will be able to provide both of those services for free, regardless of your health insurance status. Okay. And so we want to look for a test to treat location, and we'll put the link in the chat box for you all. But our state health department has a handy dandy treatment provider or treatment finder where you can find a test to treat location for getting tested and treated. There are a couple different options for treatment. And this is, I think, something that people have forgotten about because we go, there's no more COVID. But that somebody, that said, we're not doing COVID anymore. We're done with COVID. And so people forget about the treatment part. But this is important because so many people are still dying due to COVID every day. And so one of the things that will help in addition to vaccines is getting treated. And so you want to get treated within the first 5 days of symptoms. So you can't, if you're sick and you're symptomatic, test quickly and then get treated. There's a couple of different pills that you can take. You have to go to your healthcare provider or a test to treat care location to get those. But within the first 5 days, you can't just hang out and say it's been a week
it's been 2 weeks and then try to get treated for it, it's not going to be an effective source of treatment for you.
Gotcha. So if I am tested and treated and I feel like I'm getting better, I'm going back to work, what should I be doing? I know there's a guide of the CDC website that tells us when your days are up, when you can go back to work, when you can be around friends and family again, but what should you be doing at that point?
Yeah, so this is the difference between isolation and quarantine, right? Mm-hmm. So we got that question a lot in the pandemic. And even now, I think they're used interchangeably, but isolation and quarantine actually mean different things.
Right.
So isolation is what you do when you are sick. So I am sick and I have COVID or something else. Mm-hmm. TB, some other communicable disease, I'm going to isolate and be by myself at home. And then quarantine is what we do for your close contacts or people that we think might be sick or that were exposed to you. So I isolate, that's a good way to remember it. I isolate for myself and we quarantine other people who we think might be sick in order to prevent the spread. So isolation rules still stand. If I get sick, I stay at home for 5 days and then I can go out and be with the people. But those additional 5 days after I finish my isolation, then I need to wear a mask. So 5 days at home, 5 days in a mask after you're in isolation, or if you're at work or around kids or whoever else. If you're around other people, 5 days at home and then 5 additional days out in the public with a mask on. And then what we don't have anymore is quarantine. So y'all will remember the 14 days of quarantine that got whittled down over time. We don't quarantine anymore. So if you are exposed to someone, if they test positive and you were exposed to them, you no longer have to quarantine, but we do want you to wear a mask. So if my child was sick or my coworker was sick and they said, oh, I tested positive for COVID, we want you don't have to take it to the house anymore, but we want you to wear a mask.
Okay. So another question for you about timing or close contacts, really.
Yeah.
So in that final 5 days, I have 5 days that I isolate. In my additional 5 days, I'm wearing a mask. Do I have to tell people why I'm wearing a mask? Do I have to tell them I have COVID?
I mean, that's your personal business. So let me say this. We're not going to tell at the health department that you have COVID. We're not going to tell other people that. And we want to remember that people wear a mask for a lot of different reasons, right? So some people wear a mask all the time because they know I'm high risk, I'm immune compromised, I am an older adult. And so I want to wear a mask at all times. So we can't assume that just because people are in a mask that they have COVID. But we do want you to share if you were around somebody that has COVID. We want the courteous thing would be to say, hey, you might want to go get tested. And we want people to do that. And if you don't know how to do that, there are some resources on our CDC website about how to help notify people. Mostly they're folks that we know, like our household members are the ones that we're most worried about. And again, close contact is 15 minutes or more. I was around you. We sat next to each other in a meeting or during a webinar. A close contact within 6 feet. And we want to, then that would be a close contact.
Gotcha. All right. So we've got information about testing and treatment. We have information about vaccines and prevention. I think that we're armed. We're pretty much got our education bag full on today about our top 3 respiratory illnesses that we could be dealing with in our communities. If you want more information, still go ahead and use those links that were dropped into the chat. And of course, if you have additional questions, want to talk to someone in our immunizations clinic or ask a question of Dr. Green or myself, you can give us a call. It's 910-433-3600 here at the health department, and they'll get you directed to where you need to be. So I checked the chat box and the question box, and I didn't see any questions as of yet. As a reminder, all of our attendees, you are all muted. So if you have a question, we do ask that you put that in the question box or place those comments into the chat. So we're going to continue with this health literacy series and learn more as we go along. As we spoke before, we'll be acknowledging awareness days. We'll be talking about programs that are here within the health department, such as our WIC program, Triple P, or our positive parenting program. Our health education division may host some sessions, and we'll provide, just a really informal lunch and learn, have your snack off to the side, and be able to improve your understanding and awareness of issues that are related to health and the way that the health department is responding to those issues or being active within the community or collaborating with community partners to address those. Speaking of community outreach, so if I can't get here, you've mentioned that we have the Uber Health program, so I can catch a ride to the health department. But those operating hours don't necessarily align with my schedule for work or kids or any of the in between. What are some opportunities I have to still get vaccinated out in the community?
Yeah, so we do a number of outreach events. We have a great team that does not just for immunizations, but for other services. And I know we're going to talk about outreach again next month during our STD. But for immunizations, we have a couple of opportunities. One, so don't forget, we have a late night clinic. So the second Tuesday of every month, we do late night clinic. So if you are a working family or you just have non-traditional hours, you can come to see us for late night clinic, and we are open until 7. The last appointment typically or walk-in kind of depends on the time of year, but try to be here by 6:30 and we'll get you taken care of our immunizations on late night clinic. And then again, that's the second Tuesday of the month. And then we also do lots of outreach events. And so, for example, last week we were over at the senior center, we're doing some flu and COVID, and I think they're playing bingo. Next, let's see, what date is that? February 10th, our outreach team will be at Little Land. So our friends at Partnership for Children are hosting Little Land. This is their big event that they do every year to help the littles come just have fun and play. And we'll be doing COVID vaccines and flu vaccines that day. And I should say it's not too late in the flu season. We get questions about that all the time. Like, it is January. Do I still need to get my flu and COVID vaccine? Yes, you do. You still do. You still do. It is not too late to do that. But they will be there February 10th. It is from 10 a.m. to 2 p.m. That event is free. Your vaccines will be free. So if you need a Saturday, that's a good day to do it.
Awesome. So plenty of opportunities out in the community where the health department is partnering with our neighboring agencies to ensure that you all in our community have the services that are needed. Anything else you want to tell us about as we're exiting respiratory season, but still being mindful and acting as a preventive effort?
I think one of the questions that I still get, we get to do WIDU every Monday, Wednesday, Friday. So that's another place where you can hear us talk. We always talk about COVID, and we do that at 8 a.m. So tune in there. But one of the questions that we always get for that group is, do I have to continue to wear my mask, and when do I wear my mask? And are you going to make us wear a mask again? So we regularly get that question. And so, right at this phase, after the end of the public health emergency, we really are in a place where people can make those ebbs and flows will dictate when we wear a mask. So you might see an emergency room or the health department or a business say, those numbers are really high and we want everybody to wear a mask when they come to the emergency room. So you're going to see that. Other than that, you don't see as many requirements. Some churches, we talked about this morning on WIDU, are still requiring that because they serve a population that's older and more at risk, and they want to make sure they're protecting everybody that's around them. There are times when we always want you to wear a mask. If you have COVID, we want you to stay home. But 2, if you are coming off of a COVID infection, put a mask back on. If you, again, are your close contact, wear a mask. So those are times in which we want everybody to wear a mask. We still, if you need figuring out how to get a mask, there are widely available. So come help you kind of figure out how to navigate that.
So just a surprise question for you. I didn't tell Dr. Green about this before today, but I know we talked a little bit about being able to still receive services, whether or not we have insurance.
Yeah.
But big shift recently, Medicaid expansion.
Oh, yes, Medicaid. Oh, how do we not talk about that?
How do we get access to that information to be more health literate about the available insurance options to us?
Oh, yes. So big news in North Carolina, December 1st, Medicaid expansion went live. There are many, many folks that are going to be eligible for Medicaid expansion. And this is a game changer, not just for, those that are for healthcare in general, right? Because we have people that have access to prevention services that did not have access to that anymore. So a lot of people that were, if you had family planning Medicaid, many of those individuals were automatically enrolled in Medicaid expansion. If you were not on family planning Medicaid and you think you're eligible, we encourage you to go online. I'm going to find the website real quick for us. You're going to see me navigate in real time. So you can go to our county website and look right there on the top of, I didn't even plan that. At the top of our county website, you can apply online for Medicaid expansion on ePass. And so I'm going to put that link in the chat box. On behalf of our friends at DSS, they would like you to apply online first and foremost. But you can also go into our DSS office. They're across the street from us at the health department here on Ramsey Street. But Medicaid expansion is really important to getting people access to things like testing for vaccines, treatment options, all things COVID, flu, and RSV. So game changer for us for sure for Medicaid expansion. And we want people to take advantage of that. And if you are not sure if you are eligible for Medicaid expansion, go back to our county website and look to see if you are eligible. We've expanded if you are about who is eligible. That's what Medicaid expansion is. That income level has been raised for folks after December 1st here in North Carolina. So we want to make sure that people are, even if you don't think you're eligible, check out the website and you can look for more information.
Awesome. All right. So we've made it to the end of our information part of the segment. And so now we're going to dig a little bit into some of these questions that we have. You can continue to add those to the question box or drop something in the chat and we'll make sure that we address those. So first question for you. Can you catch a cold by being outside when it's cold? Do I got to put socks on the baby and wrap them up? Put a scarf over my face? It's cold outside. I get sick from going outside.
All right. So this is like my grandma. Every time I go home, you got to put a coat on that baby. Put a coat on that baby. Put a coat on that baby. Put socks on. Mm-hmm. After you get out of the shower, if you don't dry your hair real fast,
catch a cold.
You're going to catch a cold, right? So we are. Those things are true. We should wear a coat when we're outside, but you're not going to catch a cold from just being outside. Okay. What we are concerned about is frostbite and making sure that you. All your extremities. We're concerned about that part of it, but you're not going to catch a cold from just being cold or just being outside. The cold virus and all of our respiratory viruses don't just, sort of attack you when you go outside, but you should put a coat on outside. So your grandma's right about that. Yeah. You should put a coat on and you should put socks on the baby, but not because they're going to catch a cold, but for other reasons. And so, viruses transmit from person to person, not just because it is cold outside.
Okay. So I'm going to still listen to my grandma.
You should still listen to your grandma. You should still listen on the baby.
All right. So our next question is, when can we stop taking COVID-19 tests?
Oh, so COVID is here with us, friends. Hang in there. It is here for the long haul. COVID, we are past the point that COVID is just going to disappear.
It's the bad C word. I don't want to say it.
I know. I don't want to say it either, but it's here. Yeah. It's not going away just because the public health emergency ended does not mean that COVID went away. So that means we're going to have to keep taking tests. We're going to have to keep getting vaccinated. That is not going to go away. After the flu and doesn't go away just because we want it to. We still need to get tested for flu, get tested for COVID, get tested for RSV. Again, you can get those at-home test kits from us here at the health department.
Awesome. All right. Can you still update my vaccine card?
Ooh, we get a lot of questions about your vaccine card. So those CDC, Centers for Disease Control COVID vaccine cards that we all got at the Crown that we gave you, that you laminated, and then we said that you need to unlaminate them because we have more vaccines to get. They are no longer issuing those COVID vaccine cards. So the CDC has stopped shipping those out. And so if you go get your vaccine for the first time tomorrow, then you will likely not get a COVID vaccine card. But if you still have your card and you are still holding it tried and true, We will, if you bring it to us when you come to get your updated COVID vaccine, we'll update it for you. We'll write on it for you. But if you go to your other healthcare provider, you probably will not get it. So if you need to know if you've gotten a COVID vaccine or what my record says, you can go back to the healthcare provider in which you got your vaccines from, and they can give you a copy of your record. We have a beautiful thing here in North Carolina called the North Carolina Immunization Registry, and most healthcare providers can help you look up your vaccine record.
Awesome. So if you need help with that, again, that same number is available to you to contact the health department. 910-433-3600 is our number here. And you can reach out and we'll get you connected to our immunizations clinic to get that information if you need your record.
And I'm just navigating here to we have a vital records and a medical records department that can also, if you got your vaccines from us, can also assist you.
Awesome. All right. Well, I don't see any additional questions, so we'll use this last part of our time to wrap up and give you some information about our upcoming events. Dr. Green shared about February 10th. Our health department staff will be participating in Little Land. So that is hosted by the Partnership for Children. It is their event for all of our littles, kind of catered to 0 to 12 and families. And so if that's you, please go out and join them. Lots of great fun for the little kids and information and resources as well. The health department will also be there providing COVID and flu vaccines. Next, we want to shout out for National Black HIV/AIDS Awareness Day. That is February 7th. So we are promoting testing. We encourage you to know your status. And the only way that we can do that is to get tested. You don't know unless you know.
You don't know.
So we're encouraging you to come here and get tested in our adult STD clinic, or if teens would like to get tested, they can do so in our teen wellness clinic. We will be incentivizing those who come to get tested on February 7th on National Black HIV/AIDS Awareness Day. And you will get a prepaid gift card if you decide to get blood draw tested for that awareness day. So we encourage you to come do that on February 7th. Our next announcement is for prepared childbirth classes. The health department does provide prenatal education to moms or partners. They can come in and be a part of that series. Those classes are held on Thursdays beginning January 31st from 5:30 to 7:30. Each family that participates will receive a $25 prepaid card for each session that they attend. And they'll also receive baby bucks for our baby store, which is our incentive-based program with baby items in our health education division. These classes are free. Again, a pregnant person and their partner can both attend. And if you'd like to register for those, you just call 910-433-3858. You can speak with Ms. Anderson, who is our childbirth educator.
And I put that number in the chat box for those that are on with us live.
Thank you. All right. And then also our WIC division. So if you are a military service member or dependent, we'd like your feedback about our WIC services. This past year, we launched our WIC services on Fort Liberty through our Fort Liberty partnership. And it has been quite successful as far as seeing clients and families and bringing that service to a more convenient location. But we'd like to hear from you. So we have a community survey available on our website. It's an opportunity also to participate in some feedback sessions through our focus groups. And the information, we're encouraging military families to participate in our WIC program and to provide feedback either through the survey or participating in the focus groups. So tell us how we did. The surveys will be on our website at cumberlandcountync.gov, and you can find the links on the WIC webpage as well.
And those are in your chat box, along with the phone number to call if you're interested in being in a focus group.
Thanks. Thank you, Dr. Green. All right. And so we reached the end of our show time. We want to encourage you to give us feedback about this series. This is new. We are wanting to make sure that we are providing health literacy support to the citizens of Cumberland County and ensuring that you have the information and access to understand health issues. So we encourage you to provide us with feedback. There's a survey that we've developed about this series that you can go onto our website and take the survey to tell us how we did. You can find that link again on cumberlandcountync.gov. You click on departments and public health. And then on the side of the page, there are tabs. You click on videos, and that's where you'll find the Hello Health page. You will see the dates for each one of these sessions, the fourth Wednesday of every month from 12 to 1. And you'll also see the resources for each episode. So today, the links that we provided, those will be also on the resources tab. And for any of the future meetings, you'll also see any of the resources there. So again, we encourage you to take the survey, go ahead and visit the website to get any of the resources and share those amongst others so that they can improve their health literacy as well. And then if you need to play back, you want to remember, what was that thing she said about the testing, or where did she say the rule was about the vaccinations? You can play this back. So you can play this back on our YouTube, Cumberland County NC on YouTube, and then we'll also post it to the health department's social media pages, a link to that. And it will replay on Cumberland County NCTV, which is Channel 5 on Spectrum Network. So if you have any questions about today's topic, which was respiratory illnesses and the startup of this new health literacy series, please email them to us at hellohealth@cumberlandcountync.gov. Next month's topic will be HIV and STDs. We'll hear from staff in our STD clinic and our epidemiology clinic. And if you have any questions that you want to prepare for them in advance, or things that you want them to touch on in their topic series, then you can also send those in email to hellohealth@cumberlandcountync.gov. So I'll do one final check to ensure that we don't have any other questions or comments in the chat. Don't want to miss out on those. All right, and seeing none, thank you all so much for joining us here today. We really appreciate it. This is the start of something new and the start of something great. You'll have a different host and a different presenter each time. So hopefully your next host will be able to provide you with some information and be really engaging as well. And so thank you so much, and you all have a great afternoon.
Thank you.